And of course, in my practice over the last 5 years, I've come to specialize in peripheral neuropathy, which can be a debilitating condition for a lot of patients. It's commonly associated with diabetes, but what I've come to learn in treating many patients with peripheral neuropathy, it isn't always the diabetic condition that causes it. It can be a whole host of different causes. And the amazing thing is I'm seeing a lot more younger patients developing this peripheral neuropathy. I've seen patients as early as their late 30s, which is unheard of. Usually this is a condition reserved for the elderly as we get past our 60s. And the condition basically can be a multitude of symptoms ranging from numbness and tingling in the extremities, usually the feet, but can also occur in the hands. It can be debilitating sharp pain. Patients sometimes describe that they're walking on glass or nails. And I've had some patients where the nerves in their feet become so damaged that they actually start to lose their balance and are now at more risk for fall. In fact, an interesting story, I had a patient whose sensory perception, because it affects not only what's called the motor function of our feet and the muscles throughout our extremities, but also affects the sensory perception. And that's what gives the patient the pain or the numbness and tingling. But one of the things that can usually does is it decreases and sometimes even eliminates their ability to feel things like hot, cold, pressure, prickling, touch. Had a patient who had such bad sensory loss in both of his feet that he had stepped out a nail. Can't recall at what point he did this, never felt it. The only way it was discovered, which we're estimating probably a month later, was on a routine podiatry appointment. His podiatrist had palpated this nail lodged in his foot. So he sent them off for an x-ray. Sure enough, it confirmed it. So about this time, he had come to see me as a new patient for peripheral neuropathy. And within about a month of treating, and the Avazzia was part of that treatment, he started gaining sensation back. And the interesting thing about this story is now he's starting to feel this nail, which I guess is a good thing. He went back, we sent him back to his podiatrist to take a look at that again. But that's how bad and debilitating peripheral neuropathy can be. So having a tool such as the Avazzia, the professional device, of course, we use in the office, but I also will sometimes, depending on the severity of a neuropathy case, we will sometimes provide one of the home-based units for our patients to use at home. And again, depending on the severity, we'll have these patients using these things sometimes twice a day to resolve their peripheral neuropathy condition. So it's been quite an asset to our practice to be able to take our skills and training and our ability to help patients with neuropathy to that next level, and the Avazzia has been a great part of that.